shielding, very good. We do not need to wrap the shielding all the way around, right? We can just kind of like lay it over the lap, and it should stay. But up to the patient, whatever they like. All right, all right, are you still able to see okay right now, like that?
Oh, what we could do is, I don't know what's easier. I guess we could now with this, I guess.
If you need, someone can just turn on their flashlight and you can kind of.
Oh, actually, you know what?
All right, so
Can't do it one here. Okay.
our patient is going to lay on their back. They're going to bend the affected lids. Now, sometimes patients will try to sit up to see what is going on. Is that okay? Depends on the patient. Some patients are able to hold their position while sitting up. Other patients need to be on their back for the exam to work. So just take a look and see whether or not the patient is able to hold their position properly while sitting up. Okay. If you want to make things easy, just make all your patients lay down. We're going to be starting with the toes. For the toes, we have an angulation. So, quick trick about angulation. All of these exams are 40-inch SID. When you angle, the SID does change. So, something that you can do as a rule of thumb is that for every 5 degrees of angulation, you reduce your SID by 1. Right, so if you have a 5-degree angle, what should your SID be?
5-degree angle would be
39. Great. 10-degree angle?
38.
Good. 15-degree angle?
37.
20-degree angle?
36.
Right, so we just take off 5 degrees for every, we take off 1 inch for every 5 degrees we angle. Right, so if I'm starting here at 40, and I know I need a 5-degree angle, I would start by dropping this to 39 and then doing my 5 degrees. So that will give me approximately 40 degrees after the angulation. Does that make sense?
We use 15 degrees angulation, right?
Now, for the toes, we use a 15-degree angulation, right? And that is to match the angle of the toes here. So, if I have a 15-degree angulation, what should I start my SID at?
36.
37, very
Okay,
good.
okay, yeah.
15 degrees, right? 5, 5, 5. So we take off
3
3
inches.
inches.
Okay.
All right. So I start here at 37, and now I angle 15 degrees towards the head, right? 15 degrees about it.
But it won't say, will it say 40 or?
So it may not say 40, right? But we measured this out, and it should be pretty close.
Okay, okay.
Okay.
So,
So when I measured this out, right, this says about 39, but the tape measures all the way here on the side. If it was more in the middle, it would be 40, right? So just rule of thumb. All right.
Where's the cathode side again?
So cathode. So yes, if you're using the cathode, the anode heel effect, you would actually be flip the root. So foot up. All right, back down. All right, so here's our free cassette. Where do we center for the toes?
Third
Third MTP, very good, right? When we're dealing with hands, right, fingers were at the IP or the PIP joint, right? But for the toes, we're actually going to the MTP joint. So, I'm gonna go ahead and get my stuff lined up here.
How does shielding help for this sort of exam? Because it's not necessarily covering where the radiation is.
Peace of mind, leakage, well, in this case we'll say leakage radiation. All right, so we're going to the third MTP, so I'm just going to slide you over a tiny bit more. Great. Notice that we need to make sure our foot is truly PA. So this line here is basically coming straight down the leg, straight down the foot, following all the way down the third MTP to the third digit, right? It's not off like this. It's not off like this, right? The foot is flat on the IR. Okay, third MTP is here, so I'm going to have this foot slide back just a tiny bit. All right, very good. And now we're going to collimate. Anyone have a marker I can borrow?
My stuff should be right there.
Oh, she's gone.
Oh, thank you, Reagan. All right, so gonna collimate nice and tight, and then throw in our right marker. Right, notice that for these toes, we are catching all the toes at once. Even if you're only interested in, let's say, the fourth digit, we still capture all the toes at once. Okay. All right, so lined up to my IR, I have my 15-degree angle, I have my 40-inch SID, my patient is shielded. Breathing instructions?
Don't move.
None, right? Just hold still, X-ray, and relax. So this is our AP toes, AP axial toes. Any questions? All right, great. So, oblique. For the oblique, we are gonna rotate the toes about 30 to 45 degrees medially. Okay, most of these lower extremity obliques are going to go medial. Now, one more thing to keep in mind. On our obliques, we need to make sure to take off our angle. Okay, so we're coming back down at 0 degrees. And so we're going to take our SID and bring it back up to 7 to 40. All right. Okay. So for this oblique, what I'm going to have my patient do, slide your foot over towards the side a tiny bit, and then we're going to take this and rotate. Now, be careful when you do obliques, especially of the foot and the toes, because it's very common for the leg to oblique, but not the foot. So make sure that they move together, right? Make sure that both of these are moving together. Does that make sense? Okay. Once again, we're going to be aiming at that third MTP, so let's take a look here. Make sure that I'm centered to my cassette. All right. Gonna lift your foot up. Back down. Turn. I'm gonna slide you just a tiny bit to the side. There you go. Okay, right. Third MTP right there.
So like for this
And this is-
position, are we just looking
Slide back
at
a
all
tiny
the
bit.
toes, or are we looking at an individual toe?
So once again, oblique is going to include all the toes.
Okay.
All right. So third MTP. Right. Get some of our metatarsals, and that is going to be our oblique toes. The entire foot is rotated about 30 to 45 degrees. Okay. Any questions here? So far, so good?
Yes.
Lateral. So this is probably the trickiest one for the toes, at least. So with the fingers, right? I want you to think back to when we were doing fingers. When we did lateral fingers, how did you do a lateral fifth digit?
Lateral medial.
Like this, right?
Yeah.
Good. Lateral medial. How did you do a second digit?
Medial or lateral.
Medial lateral, right? You flipped it. Same thing for the toes. So toes 1 and 2, you're gonna turn the patient towards the medial side. You're gonna turn them internally, right? So your x-rays are gonna be lateral medial. For everything else, 3, 4, 5, you're gonna turn the foot the other way, outward. So your lateral will be medial lateral. Okay, so let's demonstrate both of them.
Which would you like first?
Since you're already turned this way, let's just keep going the same direction. Great, so we get our patient onto the side, right? We get this foot nice and sideways, and we're gonna do our lateral medial views of either the first or the second digits. All right, so I'm gonna move this board. Good, just plop down right there. Okay, so let's start by trying to look at some of the toes. Okay. For the laterals, this is the only time when we actually center to either the IP or the PIP for the toes. Okay, so AP, third MTP, oblique, third MTP, lateral, either IP or PIP. Okay, so let's take a look at this first digit here, this one with the IP. So, bend your legs, slide you backwards. All right, great. Right now, all these toes are superimposed on top of each other, correct? So you're not going to be able to see them individually on the X-ray. So what we need to do is we need to be able to separate these toes apart. Or at the very least, we need to be able to isolate the toe we are interested in. So if you have tape, use some tape to pull it out. If you've got something like maybe a tongue depressor, you can use that to kind of pop the toe out. Or if you don't have anything like that, usually I take like a paper towel like this and create this sort of wedge. And then, okay. And then with this, we just pop the toe out like this.
Like this part sitting on
Feels like a
top.
pedicure.
Uh, by the way, I'm not super zooming in on anybody's, foot or anything, just so
All
you
right,
guys know.
so
Appreciate you.
do you see how we isolated the first digit here? Right, so just popped it out by using this wedge, right? Second digit, same thing. We just take this, pop it out, isolate it using this wedge here. Right, so center right there on that PIP. Will it show up? Maybe a little bit. Right, so ideally you'd have something that's more radiolucent to pop it out with. Okay. But usually it's going to be okay. Right, so,
How common are toe X-rays?
they show up, but they're not very common. So I would say maybe when I was working, I would see toes once every month or two. Okay. So lateral toes for the first and second digits. Does this make sense? All right, great. Make sure that the foot is truly lateral, right? So to do that, make sure your patient turns all the way. And of course, don't forget, just throw your marker in here. All right, so X-ray, and that's our second digit. Now, let's go in the opposite direction. So this time, Jay, could you turn towards me, please? Doesn't have to be all the way, just enough to get your foot sideways. Perfect. Right, so going lateral the other way,
This is so much more comfortable.
right? Patient does not need to lay on their side, much easier. Now, here, we are still gonna make sure to follow the long axis of the toe, right? So since this foot is coming in this diagonal direction, I'm gonna turn my cassette to follow this same diagonal direction. Make sense?
Are you gonna angle the?
I am also gonna angle the tube head, yes,
Is that angle or tilt?
or rotate. I'm gonna rotate the tube head. Okay. Maybe a little bit this way, that way, and then maybe a little bit. Okay. Once again, I'm going to be aiming at that PIP. So slide back a little bit. Very good. And now I want you to take a look at how this foot is laying. Do you see how the foot is tilted in this way? Right. Leg is all the way flat on the bed here, right? And that's caused the foot to actually invert. So we are going to control the foot here at the knee, right? We're going to raise the knee up, and that's going to control the inversion of our foot, right? So if we see that it's not, if it's over rotated or under rotated, we just change the knee here, and that is how we will control our image.
Is that good?
Yeah, that's fine. So if you want to put a pillow there, that's fine. Normally, This is fast enough that you just have the patient raise the knee up a little bit, pop the toe out, and that's that. Okay, in this case, let's do something like the third digit. So I'm gonna pop it out, squeeze in my wedge. Sorry. All right. Once again, I'm gonna aim at that PIP. So lift up a tiny bit.
Is this how the book says? Like, what does the book say to do? For
Yes, this is what the book says to do.
Okay.
Rotate. Mhm. So yes, the book also says to use something to pop the toes out with.
Okay.
Oh yeah.
The
no.
toe of interest?
I was just asking you,
Toe
like,
of interest.
specifically, does it say like, oh, use a? I don't know.
Oh, does it say use a paper towel?
Or like anything specific, like.
No, I don't think there's anything specific.
Obviously, you know, we did, but.
Do paper towels show up on the?
Slightly. All right. So that would be how we do toes in the other direction.
Okay.
Make sense?
Oh, do they have caunation on it? It's not very much caunation. Okay. Okay.
Okay. All right, great. So that takes care of the toes. Very good.
Aye.
Thank you, Jay. All right, let me just
Drop
lower
the
this
table.
back down. Yes. Thank you. Good job.
I was a little worried.
I
All
know,
right.
I know we're gonna get there eventually, but they have to take their sock and shoe off for